Hello there, and welcome to today's episode of the Only Endometriosis podcast you need. Today I'm going to be talking and probably ranting a little bit about why conventional treatments alone aren't enough for endo. So I just want to start by saying that I'm going to refer to what I do throughout this episode as alternative medicine. That doesn't mean that I view what I do as an alternative to the conventional medicine. It's just a way of explaining or being consistent in what I'm talking about today. I think a lot of people assume that I am anti the conventional treatments, and I'm not. For the right woman at the right time, this is absolutely the right way to go. However, if you're not that right woman, if it's not the right time for you to go through this conventional treatment pathway, then I do believe we should be offered alternatives. We should be given an insight into alternatives. When I'm talking about conventional treatments, again in this episode, I'm going to be talking about hormonal therapy, I'm going to be talking about surgery. When I talk about alternative medicine, I'm going to be talking about the natural approach that I and thousands of others have taken. Now, again, I just want to stress that I'm not advocating what I do necessarily as an alternative. Everybody has their right to their own belief and to make the choice that works for them at that time. So if you want to view what I do and what others do as an alternative to surgery, that's absolutely fine. If you want to view it as something that you do to try and prevent surgery, that's absolutely fine. If you want to view it as something that you can do post-op to aid your recovery and minimise the chances of endo coming back, that's absolutely fine. And if you want to look at it as something to do alongside conventional treatment, that's absolutely fine too. It's all possible and it's all doable. The other thing to say is that women who come to me who talk about natural ways of managing endo, that sort of term, managing endo, can look completely different from woman to woman. And again, that's absolutely fine. It's all about choice and it's all about personal preference. For some women, managing endometriosis simply means that if they get, let's say, excruciating amounts of pain, when that pain hits, they want to be able to do things that minimises that pain. Now, that could be natural pain management techniques. It could be medication in conjunction with natural techniques. Whatever their ideal is, that's absolutely fine. That's what that means to them. There's other women on the other end of the spectrum, women like me, who want to completely delve into their endometriosis, who want to completely understand what's going on and manage it on a full and complete level. So they want to understand what triggers it, understand mainly what causes it, and how to stop flare-ups happening. Most women are somewhere in between. So most of the women that I talk to who want to overcome, manage, whatever you want to call it, endometriosis, tend to be in the middle of those two extremes. So they want a little bit more control than just natural symptom management as and when it hits, but they don't necessarily have the time, the energy, the money, the inclination to understand it fully and to dive that deeply into it, to completely understand and prevent flare-ups. Wherever you are on that spectrum, wherever you are on that sliding scale, again, it's absolutely fine. It's personal choice and personal preference. The reason I get ranty is because I don't think we're given enough choice. We're not given enough information to fully understand the preferences that we're able to have. So I am really lucky. I talk a lot about natural management of endometriosis, and I became very aware this last week when I was working with one of my clients just how indoctrinated, I suppose, is possibly a word I can use, but just how normal all of this is for me. But my journey has taken 20 years. It doesn't have to take 20 years. It's just that's the point where I'm at now. I've been managing my endometriosis naturally for over 20 years. I've had 2 big flare-ups in that time. It's not that I've cured my endometriosis. My endo is still there. It just doesn't impact on my life anymore. I can manage it. Okay, I have bad days, but I know how the bad days are going to look and feel. I know what to do if they do occur, and I know what to do by and large to prevent them occurring. Doesn't mean I do it all the time. I have that control. I have that choice. But many women aren't actually given that choice, and it completely baffles me. When we talk about the patient charter, when we talk about what's actually our patient rights here in the UK, we are actually, it's enshrined, if that's the right word, it's enshrined to us that we have choice over the treatment that we receive, yet we're not actually given any information about the stuff that I do. Now, like I say, what I do can be used for post-op recovery, it can be used to try and prevent treatments, it can be used to manage symptoms, or it can be used to completely prevent endometriosis symptoms, triggers occurring at all. All of that is absolutely fine. Yet the vast majority of specialists, of doctors, of gynecologists who you go and see about endometriosis never actually talk about the alternative things that you can do. And from what I can tell, endometriosis, and again, I'm including adenomyosis, fibroids, polycystic ovaries in this as well, we're never really told or advised or even given any information about things like Reiki or acupuncture or reflexology. Things are improving. A lot of women now report that they are actually being told about different things, but that tends to be just due to just down to the experiences of the GP themselves. It's not woven into the pathways. I used to be a health and social care commissioner. I know how these things work. I should be able to get into these places and say, look, we have things that's working. Why aren't we including this in the pathway? But for some reason in women's health, that door is completely shut. Now, I've worked with people with cancer. I've worked with people with arthritis. I've worked with people with chronic fatigue symptoms, or chronic fatigue, ME. I've actually worked with people with MS as well. But all of these conditions, there have been elements of information given to people to help them manage their symptoms. Yet with endometriosis, we're told that it's bad. Or I don't know if that's true. I've said we're told that we're bad. I'm not certain we've been told it's bad, but there is an assumption that natural management of endometriosis is going to cause more harm than good. So I have never seen any evidence that this is actually happening. There's nothing on the internet, there's no research papers, and from my experience working with women since 2008, there is no evidence that I can say that not addressing endometriosis using natural ways, using alternative medicine, causes harm. And it's quite scary because when I started on this journey in terms of during COVID, when I decided to go really vocal about endometriosis and when I sort of decided to take it global, if you will, I started talking a lot on social media. I was hosting free webinars, I was doing free lives, I was really putting myself out there. And the amount of abuse, let's call it what it is, the amount of bullying I got online for even hinting that there might be natural ways to manage endometriosis was absolutely shocking. And it's taken me a lot of years to be able to stand up confident in what I do, because I'm living proof. Even if you just need one person, I am that one person that says, look, I've managed my endo for 20 years. I haven't needed surgery. I've had 2 flare-ups. It is possible. Okay, there are limitations to natural remedies. There are limitations to this natural approach, to this alternative medicine approach. But they're not quite as scary as the limitations of conventional medicine. We put so much faith in our doctors, we put so much faith in the Western medicine procedures, that even though we are told, if you Google, will a hysterectomy or will surgery cure endometriosis, then there's not a single site that comes back and says yes. Every single site says no. Every single site says it will offer you temporary relief from symptoms, but there is no cure for endometriosis. Yet women queue up in the thousands to get surgery, to get hysterectomies, even in the knowledge that it's not going to give long-term solution to endo. And that's because we don't have any other options, or we don't feel as if we don't have any other options. Now, what I do might well not work for everybody. It might well not give somebody the 20 years of relief that I've had. It might just give you 3 years of relief. But that's not necessarily any different to conventional medicine. When you start integrating alternative medicine into the endometriosis pathway, even not necessarily on a national level, but on your own individual level, you will start to feel so much more empowered. You will start to feel so much more better in yourself. Your relief, your symptom management becomes so much more sustainable. You're no longer relying on drugs. You're no longer relying on medication. You start to build up a toolkit that you can use. Now, this isn't a quick fix. This isn't something that I can teach you one method for reducing pain and inflammation in your abdomen, and then by the time your next period comes around, you're instantly able to manage it. That's not the case, and that's probably the biggest difference between the conventional medicine and the alternative medicine that I'm talking about. Conventional medicine is almost like it's not a quick fix. I don't want to suggest it is, but it's almost like when I talk to women who are considering surgery, so many times I just hear the words, "I've just had enough, just whip it out, please, because I just want to feel better next month." And these women are at the point where they don't care if they have to have a couple of months of post-op recovery. They're at the point where they don't care if their endometriosis is going to come back in 6 months. They just have had enough of this constant cycle of their symptoms. What I offer is a different approach, and it's different because you're not going to get absolute instant relief with this. It could take 6 months just to start to feel better. Chances are it won't. I don't think I've ever really worked with anybody who has taken that long, but it could do. It could take 6 months for you to feel better. The difference is that at the end of a program, at the end of learning how your body's working, at the end of learning what techniques, what therapies, what methods work for you, you will be completely empowered in whatever that end goal that you have is. You'll be completely empowered when you get pain to manage that pain, to reduce that pain and carry on as normal, or you'll be completely empowered to navigate life without your symptoms flaring up at all. Whatever it is that your goal is, you will feel empowered. With surgery, with the hormonal implants, okay, you're going to get that temporary relief, but at the end of that, you're back to square one. You don't have that empowerment. If you view alternative, and again, with a small a, I'm not saying it's an alternative, but if you view alternative medicine as either a support or a temporary relief, then you are giving yourself that power. And you can use it alongside conventional medicine if you want to. There's nothing to stop you. Always speak to your doctor if that's a consideration, though. Don't just go all in. Let people who you're already working with know that this is a path that you're going to embark on. But it's absolutely fine to do it alongside conventional medicine. It's absolutely fine to do it after surgery. That massively reduces the risk of endometriosis returning, certainly of your endometriosis symptoms returning. Or if you just want to use it, like I say, for when you get bloating or when you get fatigue or when you get pain, that's absolutely fine too. But at least it's giving you some power back. It's enabling you to take an element of control back that the surgery and that the hormonal treatments don't do. So if I can give anybody one piece of advice or one piece of solace from this podcast, I can't cure endometriosis. I haven't cured my own endometriosis. I simply manage my life to some extent. I manage my triggers. I manage my endometriosis because I understand how it impacts on my body. I help other women to do the same. I help women to manage their symptoms, and I help women to control whatever it is about their endometriosis they want to control. And you can do exactly the same. You don't have to come to me to do this. You can do this. You can either tread your own path, because that's exactly what I did. I simply went about trying different alternative medicine techniques. I worked out what worked for me, and then I learned to do them on myself. That's all there is to it. There's no magic. There's no hocus pocus. There's no witchcraft. There's a little bit of witchcraft, but there's no magic spells around what I do. It's simply understanding what works for me and then using that knowledge to go out and help other people and learning from their journeys as well. I'm not suggesting you all go out and help each other, although what a lovely world that would be. But if you want to explore the world of alternative, with a little a, alternative medicine, the best thing you can do is just to start to try different treatments for yourself. And once you understand, or once you appreciate or know the treatments that work best for you, you can then either decide to learn to treat yourself, or you can just keep having those treatments. And again, you can take this as deep as you want to go. I've done podcasts before on how to find decent therapists, but my one piece of advice, if you are going to go out there, is go and see people who have experience with endometriosis. There are lots of people out there who shine very much in their own spheres of excellence, and that's not to detract from them at all. But having experience specifically with endometriosis, even Women's Health doesn't cover endometriosis. If you can find someone who has specific experience with endometriosis, then they will be your absolute shining light. So, a little bit ranty, not as ranty as I thought it was going to be, but this is my belief that conventional medicines aren't enough for endometriosis. We're even told they're not. There's no secrecy that there's no cure for endometriosis. There's no secrecy in the fact that surgery or hormonal implants, whatever treatment that you're going down, is not going to cure your endometriosis. That is a fact. So if you're not going to cure your endometriosis, work out the level of not cured endometriosis you want, work out the level of control of your endometriosis you want, and work out exactly what's going to work for you. And like I say, even if that is to have surgery and just to use things like Reiki, meditation, all that kind of stuff as post-op recovery, that's absolutely fine. But please just know that there are alternatives out there. There are alternative things you can be doing either alongside, instead, before, after, whatever pathway you want to tread yourself. There are things open to you there that can and will help you. I hope that helps. Until next time.